Hello, welcome to Eva's Care, the Heart of Health. I'm your nurse, Eva Maria, and in today's episode, we are going to talk about depression. What is depression? Depression is a state of complete sadness and despair that lasts for a period of more than 2 weeks. If a person is in depression, or if a person is sad for a period of more than 2 weeks, we consider this person to be depressed. Depression is more common in women compared to men. Depression has an onset in the 20s. People of all ages can get depression. However, the most common age of onset of depression is in the 20s. Depression is caused by various factors, and one of them is the biochemical factor, whereby the neurotransmitters norepinephrine and serotonin have a decreased release in the brain. This causes a person to have depression. We also have unfavorable life events. Say someone loses a beloved, loses a job, loses a property, loses a business, name it, fails to get a visa, among the very many things, you know them. These unfavorable life events can make a person go into depression because if the sadness exceeds normal, the person is depressed. We also have negative thoughts about self. If someone is thinking negatively constantly about self, we consider this person to be going into depression because of their own thinking. We can tell a person having depression through the various signs and symptoms that are evident in their ways of living. First of all, we have loss of interest in desirable activities. Someone who previously had interest in social activities, say someone had interest in football, in music, in movies, name it, this person tends to lose interest because they are focusing on their negative thoughts of depression. We have poor concentration. Someone tends to have a poor concentration if they are going into depression. We have excessive guilt. Someone gets a low self-worth, or they feel they are not worthy at all. That is also another sign of depression. We have hopelessness about the future. If someone has no hope for the future, or if someone has only negative thinking or negative thoughts about the future, we consider this person to be going into depression, and it is also a sign. People who are in depression or people who are going into depression tend to get thoughts about dying, thoughts about suicide, and some of them even actively commit suicide, and others just attempt. Others also have self-harm. They tend to harm themselves as a way of punishing because they are feeling guilty about something that happened. We also have disrupted sleep. Someone tends to get an altered sleep pattern, or they get complete insomnia, or they get partial insomnia. Someone fails to sleep during the day and also fails to sleep during the night, or they alter. Someone sleeps during the day and the whole night they are awake because they are going into depression. We also have self-neglect. Someone who used to care for self, who used to wash clothes, shower, iron, and do all those things of self-care, they tend to stay in a dirty environment. They have unkempt hair, unkempt environment, and these all are signs of depression. Hope you've learned something about depression today. I remain your host, Eva Maria. Thank you for tuning in and keeping on Eva's Care, the Heart of Health. For any questions or supplements, please drop them in the comment section. Don't forget to subscribe, share, like, and follow on all our social media platforms. Until next time, bye-bye.